Dirt in My Eyes. It's Cold War Kids on the Mountain 101.5 and worldwide at themountain.live 8:35 with Chris and Michelle on the phone with us. Michelle from Companion Home Healthcare or Home Care.
Good morning, everybody. Hey, Chris.
Hey, usually we have you in the booth, but we're going to keep you at a arm's distance over there in the village this morning so we can talk a little bit.
Well, I'm in Salem and you're in Vinton, so that's not hard to do.
Oh, you're at the office?
I'm at the office bright and early. Nothing's really changed for me. We're still doing our business. We would be considered essential, that's for sure.
Hey, I need to do a live read. Want to help me with it?
Sure.
Did you know that there's a new way to nourish your body, and there's a place to get food that's healthy, and it's made from scratch in Roanoke?
No, tell me more.
It's Core Life. Core Life's open.
I've been wanting to try that place. I've heard great reviews from people that I've talked to.
They opened up just right as all this started to happen, and they're excellent. They do food in bowls. It's all made from scratch, and you build your bowl. Like we used to have another restaurant that was on the air with us for a long time where you did that, and they'll so Core Life is a franchise, but they're started up. You know, they've got 12, 15 stores around, and luckily they're built around quick takeout and delivery and things like that. So it's a great time for a restaurant like that because I'm finding it harder to eat healthy at home because now we want all this comfort food, which we know is not healthy. So I'm happy to hear about this place. Oh, I think they're going to do fabulous. Their food is fabulous. And to open up and to keep your family happy and safe and well-fed, they're offering a BOGO.
Yay.
Yay. Buy one, get one free.
Who doesn't know what a BOGO is, Chris?
Well, I do, but I never find them around. There's not many BOGOs out there. So you can
hadn't heard for a while.
You and your main squeeze can eat up down there at Core Life. They'll deliver it to you, or you can call it in, or you can go to corelife.com or make that corelifeeatery.com. I went to it yesterday. All you do is put your zip code in, and you can build your bowl right there and have it either delivered to you or pick it up. And they're next to First Watch behind Mellow Mushroom, next to the once famous Earth Fair. Which is now
I will try that. Honestly, I'm looking for something different, and I find it hard to eat healthy around this city because we are in the South, and there's a lot of fried chicken and mashed potatoes.
Yes, there is, and they do it really well at Lucky.
Oh, thanks, Chris.
Yeah. All right, so I wanted to have you on, and we would usually have you in a little closer to summer to talk about elder care during the summer months. But right now I wanted to talk to you about being a neighbor to your elder neighborhood members, how to keep in touch with them and how to keep in touch with your elder family members and precautions you should take if you do go see them. So hit us up. Tell us what's up.
I'm finding it a little amusing that everybody is having such a hard time with this isolating idea, because there is a crisis of isolating in the elder population way before any of this. So the younger people think this is awful. Can you imagine if this was your life every single day and it wasn't going to end in a month or 2 months? I'm finding a lot of things that people will learn from this whole virus idea, because a lot of our elderly do this day in and day out for years. Now you can see how it's not fun. No. I see a lot of people on Facebook saying, hey, if you know of any people that need me to grocery shop for them, any of the elderly. Well, guess what? The elderly are not on Facebook.
No, they're not.
So you actually have to probably go outside, go next door, call them. You'll have to do something better than put out a shout-out on Facebook for a lot of our elderly population.
Yeah, and ask your neighbors if you can pick them something up at the store. They really don't need to be out at the stores.
The elderly are scared to death right now. Not only are they already isolated, but they're now not having visitors, and the family is not coming to see them. I would implore everyone to call every single day. If you have an elderly family member, just give them a phone call. I know Russ has been calling me a lot more often lately.
But you're not elder yet. He's just bored.
But it has alleviated a lot of my anxiety because he lives so far away. So I can't imagine if you're an 80-year-old mom and you have a lot of other issues that you may worry about on a day-to-day basis. You know they're worried about their children. Mm-hmm. So a phone call does a whole lot of good. I figured out what my video button was for yesterday.
You have a video button? Where is that?
Yeah,
next to your belly button?
My video button. I had never used the video on this phone. I've had this phone 3 years. I know that sounds outdated, doesn't it? I don't throw anything away, Chris.
Well, no, that's about right. Just keep it clean. So did you video with Russ yesterday?
I did, and it helped so much. Right now, when we know we can't go visit people. And another crisis that I think is kind of sad, too, are the nursing homes.
That's right.
The nursing homes were already short-staffed. Mm-hmm. Now they're even worse because a lot of the workers are young mothers. With schools being closed, a lot of the workers have had to stay home.
Wow.
So I've had to work in a couple of the facilities over the last week, and I'm going to tell you, it's not a skeleton crew. In some areas, it's no crew. And it was really very frightening to be in a place like that and to realize that the care is just not there right now. So I would also ask that you call your elderly people in the nursing homes. I wish a lot of the young workers would use today's technology and maybe FaceTime in these nursing homes some of these family members. That would do a lot to make up for the lack of care, that's for sure.
You can't go visit, but can you take a care box by and leave it for your family member in a nursing home?
They're not really wanting anybody to approach the doors of the nursing home. I have some workers in them right now, and that's because they're considered essential. And, they still have to have care, but they're really they're doing temperature checks, they're doing screenings right at the front door. So I think that it would probably be a burden if people were dropping off things, especially with the unknown of, does this virus live on paper and cardboard, and could you possibly be bringing something in? I actually thought about, I had these neat blankets that I had embroidered at Christmas time with sunflowers. That's our cute little logo. And I was going to take a client that as a new client welcome yesterday. And I literally looked at that blanket and thought, they may be worried that I'm bringing something into their home. You're looking at everything now differently in a clinical way.
How are you guys handling things? You said it's business as usual for you all. You haven't. What's going on? What are y'all telling your clients, your family, the elder clients of yours?
A lot of families are having to make some really tough decisions. It has run the gamut. It has run the gamut as far as the different reactions in family members. We've had some family members that have actually upped the amount of hours that a caregiver is taking care of their loved one because they may be older and they may have some already pre-existing conditions themselves. So maybe the older children are not able to go visit mom as much, and so they up the hours of our caregiving. But then we had another that laid off their caregiver, thank God, with pay, because they want to ride this out for a couple weeks. She's a younger caregiver. She has a child, and they were worried about the caregiver bringing something in to their 90-year-old mom. So this has had a lot of families deciding. And the bad part is if you get rid of your caregiver now, mom still needs someone, so you can't leave her without any care. That means the burden is going to fall on family members. Or if you get rid of the caregiver now, in a month, she's going to be working somewhere else, and you may have missed the opportunity to have good care in this day and age. It's hard to find.
Yeah, definitely is. So I wanted you to update us on that. Give us some more tips for elder neighborhood people around you.
I'm giving out to my caregivers have gloves. There aren't any masks. I can't order any masks. Nobody has masks. So we just have to resign ourselves to that's not going to happen. But I'm asking my caregivers when they go grocery shopping, pump gas, and so forth, to keep a box of of the gloves in their car. Luckily, I screwed up a few months ago, and instead of 10 boxes, I ordered 10 cases.
Oh, wow. So you're set. You were hoarding before hoarding was cool.
Yeah, well, you go through them pretty quickly in this business, though. So I've had to do a lot more of kind of in-service of reminding everybody about washing their hands. But we were already pretty well schooled being in this profession to do that anyway.
Sure.
So it's not really anything different in the home care aspect of it. The younger ones on staff, I've had to kind of guide into staying out of public areas, and I've had to implore them that, listen, you could bring something into your client that would kill the client, but it's also your job security to keep your client healthy.
Good point. A good point.
So, one other tip that I picked up, I get to go to the doctor's offices a lot in my caregiving role because, I have clients of my own also. I was at the VA with a client not too long ago, and the client was at a ENT, an ear, nose, and throat doctor. Loved him. Oh, gray-haired Army doctor, and I respect those older gray-haired doctors more than anybody. And he made a comment that if people would gargle with antiseptic every single day, twice a day, it would alleviate a lot of the germs that we catch in our throat. And that has come to the forefront for me now. I haven't been sick with the flu in the last 3 years, and I swear, I believe it's the habit of the antiseptic and keeping your mouth clean. It just makes sense to me.
I'm a Listerine guy myself, and I also recommend XLEAR. It's a nose spray. It's totally organic. You can get it at the Co-op or Fresh Market, places like that. You can't get it at CVS, but it's good to keep your nasal passages clean and to use that Listerine.
Well, my dental hygienist, Marge, love her too. She said it so succinctly. She said, your mouth is the gateway to your health and your body.
Mm-hmm.
Now this makes way more sense than it ever has in our generation.
Absolutely. All right, Michelle, thank you. You stay safe. Keep your clients safe. Give us your how to get in touch with you in case somebody needs information. You're a wealth of information, and it's free. You'll help them out for free, or they may need your services.
Absolutely. And, Chris, I also wanted to offer that right now during this crisis, Companion Home Care is suspending my 2-day per week minimum. I usually have 2 days per week, 4 hours per day contract. If you have a family member that you're worried about and they could use a caregiver to just go shopping, catch up on some laundry, some housekeeping, pick up their medications, give me a call. I will provide a caregiver, obviously, as long as I have the staff, for only 1 day a week for the 4-hour minimum. It helps keep my girls in hours, and it hopefully will be a service to families that are looking for an option. Give me a call at 981-2255, 981-2255, or email me on our website, companionhomecareofva.com.
All right, Michelle, thank you. You keep your girls safe, and you be safe, and I'll see you at down at Local Roots here when all this lifts.
I'll have you over for dinner, Chris.
Well, we're just a couple of blocks from each other. I went to the liquor store and stocked up yesterday, anticipating that the governor was going to close them, but he didn't. So I have an ample stock of Jack Daniels now.
And I was going to say, as long as the ABC store's still open, I can do this.
Yes, we can do it. And I've got a warehouse loaded up at my house now, so just give me a call.
All right, talk to you later.
All right, have a
Bye.
great day. Thank you, Michelle. Michelle Belton, companionhomecareofva.com is how you get in touch with her, giving us an update on what it's like to be an elder member of this crazy world we live in. It is 8:49, and you're listening to The Mountain 101.5.
What Italian restaurant do you think of?
Dirt in my eyes. It's Cold War Kids on The Mountain 101.5 and worldwide at themountain.live, 8:35 with Chris and Michelle on the phone with us. Michelle from Companion Home Healthcare or Home Care.
Good morning, everybody. Hey, Chris.
Hey, usually we have you in the booth, but we're going to keep you at a arm's distance over there in the village this morning so we can talk a little.